Hi everyone, in today's clip I will talk a little bit about liver cirrhosis. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health related matters, please consult your healthcare provider. The liver is a vital organ located in the upper right side of the abdomen, beneath the diaphragm. It performs hundreds of essential functions that are critical to maintaining overall health. The liver is a uniquely regenerative organ, capable of healing itself even after significant damage. However, the timeline and extent of regeneration depends on the type of liver damage, as well as overall health and lifestyle changes. So liver cirrhosis is an advanced scarring of the liver tissue due to long-term liver damage, and it impairs basically liver function and can lead to liver failure. The liver attempts to repair itself after injury, but repeated damages lead to fibrosis and eventually to cirrhosis. Common causes of liver cirrhosis are chronic alcohol use, hepatitis B and C, excess fat accumulation in the liver, autoimmune hepatitis, hemochromatosis or iron overload, Wilson's disease or copper accumulation, primary biliary cholangitis. This is a progressive destruction of the small bile ducts within the liver, which leads to bile buildup, inflammation, and eventually scarring and cirrhosis. Primary sclerosing cholangitis, which is a progressive liver disease that causes inflammation and scarring of the bile ducts both inside and outside of the liver. This scarring also leads to narrowing or blockage of the ducts, preventing bile from flowing properly, which in turn causes bile buildup. Then there is cystic fibrosis, which is a disorder that primarily affects the lungs and digestive system, but can also impact other organs like pancreas, liver, intestines, and reproductive system. And of course, certain medications as well as NSAIDs. Now, symptoms of liver cirrhosis can vary from fatigue and weakness to jaundice, which is yellowing of the skin and the eyes, fluid in abdomen, edema or swelling of the legs and feet, easy bruising or bleeding, confusion, which is called hepatic encephalopathy, spider veins, which are blood vessels on the skin, loss of appetite, weight loss, and a whole lot more. Conventional liver cirrhosis treatment focuses on slowing disease progression, managing complications, and supporting liver function. For example, if it is alcohol-related cirrhosis, complete abstinence from alcohol is essential. For hepatitis B and C, antiviral medications are prescribed. If it is autoimmune hepatitis, then immunosuppressants like corticosteroids and others come into play. If it is excess fat in the liver, then we need weight loss, diabetes control, and lipid management to recommend. Now, commonly described medications can be adametionin to improve bile flow, which can commonly cause nausea, dizziness, insomnia, metadoxin to treat fatty liver, which commonly brings about muscle pain and restlessness, orthodeoxycholic acid to prevent gallstones with common side effects of fatigue, diarrhea, and a whole lot more. So orthomolecular medicine focuses on restoring optimal health through nutritional and biochemical balance. Cirrhosis reflects chronic inflammation as well as toxin overload, nutrient depletion, and oxidative stress. The liver has regenerative capacity, as I mentioned, especially in early stages of cirrhosis. So high-dose antioxidants such as vitamin C, NAC, alpha-lipoic acid, glutathione, as well as mitochondrial support nutrition like CoQ10, magnesium, and taurine and also low-carb diet, intermittent fasting, probiotics and detox protocols, as well as FibroScan, which is a non-invasive diagnostic tool used to assess liver stiffness and fat content. This helps detect and monitor liver fibrosis, cirrhosis, and fatty liver disease. It also is known as transient elastography and is often used as an alternative to liver biopsy. In this method, a probe is sort of placed on the skin over the liver, which sends low-frequency sound waves to the liver. The device measures how fast these waves sort of travel through the liver tissue. The faster waves equal stiffer liver, indicating more fibrosis or scarring. It also measures control attenuation parameter, or CAP, to assess fat accumulation in the liver. So nutritional therapy has shown fibrosis reversal in hepatitis C and MASLD, which is basically excess fat in patients with excess fat. There is a need to mention that nutritional ketosis, therapeutic fasting, and high-dose orthomolecular protocols have been reversing liver dysfunction for years. These root cause-based strategies don't just replicate the results of experimental drugs. They often exceed them by restoring the body's internal balance without the cost, drug toxicity, or narrow targeting of drug interventions. Now, from our point of view and perspective, cirrhosis isn't always the end. It's a warning sign that the body's biological environment has collapsed due to toxins, nutrient loss, insulin resistance, oxidative stress, and mitochondrial failure. With the right tools, nutrition, detox fasting, and targeted supplementation, you can shift the narrative from damage control to genuine regeneration. Alternative and herbal therapies suggest that top herbs for liver support being milk thistle, which is silymarin. It's an antioxidant that promotes liver cell regeneration. Ginseng, which is an anti-inflammatory and supports liver repair. Green tea extract, which reduces liver enzymes and fat accumulation. Licorice root protects against alcohol-related liver damage. Turmeric or curcumin, which is anti-inflammatory and reduces liver fat. Garlic, which is antioxidant, lowers liver enzymes. Ginger, which reduces inflammation and liver fat. Danshan, which is used in the Chinese medicine for liver fibrosis. Ginkgo biloba, which may reduce actually liver fibrosis. Astragalus, which supports liver function and regeneration. Again, you would need to actually work with a healthcare provider to ensure that you are following the right protocol to regain health. Some herbs may be hepatotoxic, that means toxic to the liver, or interact with medications. So, on the metaphysical and emotional side of things, liver cirrhosis may reflect unresolved and emotional side of unresolved emotional trauma or spiritual imbalance, loss and grief. Something was unfairly taken away from you, let's say a loved one, a belonging, a home, identity, anger and resentment. Liver is very susceptible to anger, often when it's suppressed, leading to internal toxicity, fear of change, resistance to growth and transformation, disconnection from the origins, like lack of identity, self-blame and guilt, feeling unworthy or feeling like you have failed the life's purpose, just to name a few. So healing approaches for these are through emotional releases, journaling, energy healing, forgiveness and acceptance, spiritual practices like and meditations, prayers, inner child work, reconnecting with the roots and your identity. Hope this has been helpful. Like and follow for more. Be the light.